Welcome everyone to the latest MoLab conversation. In this episode, we will discuss about securitizing mobilities. During COVID, one thing we observed is that, of course, on one hand, there is a very strict mobility restriction. People are not allowed to move, but some people have to move, like delivery workers or emergency, so-called essential key workers. And also with opening up and more people are allowed to move. One phenomenon that we observed is that governments, and that probably is particularly evident in Asia, for example, in China, when people move, and the government will put in place all kinds of measures, such as a tracing app and all kinds of monitoring method, in order to make the mobility safe for themselves and safe for the public. So this is what we call the kind of securitization of mobility. But of course, securitization mobility is a controversial thing as well. It may infringe privacy, and it may be used for other purposes. So that is a really kind of new trend. Securitization of mobility analytically can be regarded as a opposite almost to the closure of borders, right? Closure of borders and outright lockdown means nobody is allowed to move, but the securitization of mobility means that mobility is allowed, but you have to move in a particular way. And this may be related to earlier policy debates about making migration safe, that kind of safe migration package promoted by a number of international organizations as well as national governments. So today we want to explore this with Professor Sverre Molland from ANU, the Australian National University. Sverre, welcome. So now you are in Canberra.
That's correct, yes.
Yeah.
And we are not in lockdown in Canberra. A lot of the states around us, like in New South Wales, for example, they are currently in lockdown because of a COVID outbreak. But we can move around in Canberra for the time being anyway.
Good for you.
Nice to be with you, Biao.
So that is, we are now, today is 23rd of July. We are in I want to call it a turning point, but it is a time that reminds us the COVID may indeed become a long COVID. We thought it will come to end in probably 2 months ago, but now it seems that it's not going to end anytime soon. So there is periodical lockdown and open up and goes on and on. So Sverre, since you are in Australia, you are likely in the oasis of still free mobility place, surrounded by locked down regions. Can you tell us a bit about the situation, especially the method of securitization of mobility? We know that Australia adopted quite a straightforward border closure at the early stage, right? And do you think that concept is useful to understand, at least in the Australia context, to understand how the government has been managing mobilities?
Yes, it's to me, I think what has been very interesting with the COVID is how it has, in a way, visibilized, I think, precisely the two kind of dynamics that you alluded to in your introduction. So on the one hand, we have something that I believe is very familiar to us all when we think about, especially from a migration perspective, territorialized governance, right? So that is about border control, perhaps closing borders. COVID's made us very familiar to this, especially in an Australian context, because they were very early and quite quick and quite hard on closing borders. Which is still the case. It is actually quite difficult to get into Australia and also to leave Australia. So even now, even Australian citizens, if you want to leave the country, you need an exit permit. which is quite interesting because this is, as we know as migration scholars, well, historically, of course, this has been important in the past. But in contemporary times, we are not really used to this idea that you normally it's about policing what comes in, not what is departing. But right now there are issues around that during COVID. But we have these territorialized forms of governance, and then we have what you introduced, and that is this logic of security, which is not really trying to anchor things down so much, but is rather to allow movement and things to sort of go on as normal in a way, but with certain kinds of conditions and certain forms of scrutiny, like say you may have to check in with an app if you enter a building and that kind of thing. So to give some context to the Australian situation, yes, there's been a lot of, I mean, it feels a bit like Australia. They're very good at sort of casserole politics. In terms of lockdowns and closing borders and so forth. And they seem to be rather quite good at that in some ways, right? Maybe a bit too good at it in some ways. That being said, you do also have this other sort of securitization logic happening as well. So as what has, been evident in many other parts of the world, doing tracing of cases, experimenting with different regimes around, say masks, face masks. To me, that's an interesting thing. Is if you rather than locking things down, making face masks compulsory in certain places is another. That seems to me to be sort of locking in more with this security logic, if you like. There are a few really interesting things I think about Australian experiment or experience with all this. So one is not just the national border in terms of lockdowns, and this, I don't know how well known this is to an audience outside Australia, but suddenly Australians have kind of discovered that the state borders within Australia have become very real, because a lot of the lockdowns have actually been state borders, right? So, for example, right as we speak now, many states have suddenly locked or closed down their borders to New South Wales because of the Delta virus outbreak we have in Sydney and in other parts of New South Wales. And this is not the first time. There's been several rounds of this where suddenly you have lockdowns, right? As in terms of not lockdowns, but the state borders are shut basically. And you need perhaps, if you're a resident, you need a permission to cross or some form of special permission. Otherwise, you can't actually cross the borders. And this is really interesting. And one of the fascinating things too is that, surprisingly perhaps, if you look at opinion polls, these kinds of measures are actually quite popular. A lot of people support this, right? Although, of course, there are people who get angry over it. And you do, of course, have people getting annoyed and they get stuck at the border for 2-3 hours and can't cross and these kinds of things. But there is something about how it has become quite popular in a political sense. Another thing to say about the territorialized things, I guess, about all of this is how I think, especially if you think about border studies and migration studies more broadly, quite often we associate borders with, often highly racialized. And we have seen this in the Australian context. So, for example, recently you had situations where suddenly there was a travel ban from India, and that would include Australian citizens returning to Australia. And the government even included quite hefty penalties for this, actually having a punitive approach towards their own citizens returning to their home country. Now, of course, the government, it was critiqued very heavily, very quickly, and they backflipped very quickly on this. But what is interesting, of course, is that this is an example where you see kind of a racialized form of border control kicking in. At the same time, a lot of the border control, like the state borders, doesn't appear to have kind of a racialized connotation at all. It's something that applies to all citizens. And I think it is interesting for us to then to contemplate as migration scholars and border studies more broadly is okay, how do we understand these sort of forms of border measures that are kicking in during the COVID context? I find it quite interesting. Now, back to this more securitization of all of this in a COVID context. So yeah, as I said, Australia, they've been very good at closing borders and all these things. What they seem not to have been very good at has been, I guess, perhaps more through a sort of securitization lens, in the sense of, for example, the vaccine rollout has been very poor so far. And they've been struggling quite a lot with other sort of measures. That being said, you do have, of course, all these sort of tracing mechanisms and so forth. They have them in place. So, for example, just when the Delta virus was really starting to kick in a few weeks ago in Australia, immediately in Canberra, where I live, in ACT, suddenly they didn't stop mobility. It's not like they had a lockdown, but face masks became compulsory for a period of time. Everything otherwise, you could move around. You could even go to restaurants and cafes. Staff had to wear face masks. I think the rule was that patrons had to wear face masks when they do their orders, for example. But of course, when you sit down at the table and you're going to eat, then you were encouraged to, but as long as it's practical, but you weren't required to. So you had those kinds of measures in place. Right now in Canberra, those restrictions have been discontinued for the time being. We don't have any active cases in Canberra at all. We've been very lucky in Canberra. We haven't really had any active cases for a year. So it's almost like it's been normal. But on public transport, in say shopping malls, things like this, now we have a tracing app, which is compulsory. So you have to, if I go to a shop, for example, as I did earlier today, I had to go and buy some groceries, right? Then legally speaking, I have to use the tracing app. Sometimes police do spot checks. I haven't actually seen them do it, but apparently they do. And so you have these kinds of things going on at the same time. What fascinates me, Biao, is that so we have there are two governing logics, right? There's a territorialized sort of governing logic, closing borders, border control, lockdowns, quarantine measures, and that kind of thing. And then we have the securitization logic, which is, not really premised on sort of territorialized governing control, but it's more about a form of surveillance mechanisms that are in real time often, like say a tracing app. And they can even be anticipatory in the sense that they're trying in a way to intervene before things really happen. Again, tracing apps are a bit like that. It's not just about in real time tracking things, it's about doing it in a way so we can intervene before things get out of control. So there's a temporal dimension to all of this. What is interesting is that they operate together and they interact in different kinds of ways. So for example, in the Australian context, what we've seen is that the lockdowns initially were really first justified as a way to flatten the curve. And I think that was sort of the thing that happened in many other countries. I should have emphasized I'm not an epidemiologist, so I need to be a bit careful here, but the general logic was that in order for hospitals and the public health service to be able to get organized and be able to increase their capacities, a lot of lockdowns were justified in that way. Over time, this seems to have changed because now the capability of hospitals and so forth have been strengthened. So now, at least in the Australian context, and according to what's been reported in the media, one of the main logics seems to be the lockdowns often are really about buying time for contact tracers so they can catch up and trace, cases. But now, because of the Delta virus, now then lockdowns become something more about a real lockdown in the sense that it's really about trying to stop the spread. But what is fascinating to me is that you have then this combination of a territorialized logic of anchoring people in space, as it were, through lockdowns, but you do that in order to enable this security governance to take place through, say, contact tracing. So this is fascinating how these different logics kind of move between and interact in different kinds of ways. And I'm thinking myself, I never really thought about how that interactive dimension between these logics, and I think COVID is giving us kind of a fertile ground of further studies to think more carefully through, you know, how and why is it that, you know, when you move from one to the other, you know, how does that come about?